How is hair loss in African hair treated?
It is a very legitimate concern for every patient who comes to my office of African heritage to question whether any procedure is safe for his or her skin. There is a long-established pattern of errors, particularly with different technologies where people with darker skin suffered avoidable complications. When it comes to hair loss, there are some important aspects of several hairstyling traditions which impact how I approach treating hair loss. I'll discuss how I address common causes of hair loss for people of African descent in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, based on a system we originally developed with PRP and acellular matrix to help improve healing and outcomes for hair transplants. Recognizing that unexpectedly thinning hair became thicker 1 year and more after hair transplant surgery, I developed a system which has become a standalone, non-surgical hair loss treatment which has impacted the treatment of hair loss throughout the world, including many people of African heritage. The most common cause of hair loss for all people is genetic pattern hair loss, also called androgenetic alopecia. Until 2011, when we developed our hair regeneration process, the gold standard for treating thinning hair was surgical hair transplant. Surgical hair transplant is essentially transplanting hair from the back of the scalp to the front of the scalp, or to wherever there is a significant amount of hair loss. African hair, being curly and coarse, has the advantage of being able to cover the scalp more effectively than lighter or finer quality hair. In addition to a detailed history, I approach the evaluation of hair loss for people of African heritage with some specific questions which can potentially affect the success of our treatment. The first is a question about the use of hair relaxers. Hair relaxers have historically used caustic chemicals which cause the hair and the scalp skin to scar, resulting in permanent hair loss. Another hairstyling tradition is the use of tight braids and long dreadlocks. Unfortunately, these styling traditions are associated with a condition called traction alopecia, where the tension on the hair follicle compromises the circulation to the point that the hair is permanently lost. We're also seeing more patients who've chosen tattooing or scalp micropigmentation. Although scalp micropigmentation can look good in pictures or video, our patients report that as their hair thins, the pigmentation looks a little fake. There is also a particular scarring condition which is called central centrifugal cicatricial alopecia, also called CCCA, that is seen in people of African background. Factoring these aforementioned issues, our approach to hair loss remains overall to be the same as other people with genetic pattern hair loss. TrichoStem Hair Regeneration is a system I developed starting in 2011 where I used customized mixtures of PRP or platelet-rich plasma with acellular matrix, which is an advanced wound healing material produced by the company Acell. PRP or platelet-rich plasma is the concentration of wound healing and growth factors present in the blood, which is responsible for healing after you have an injury, like a cut. We prepare PRP by drawing the patient's blood, spinning it in a centrifuge to separate the serum with platelets from the red blood cells. Our practice pioneered this treatment, resulting in this large-scale interest in the use of PRP as well as Acell for hair loss in the past few years by other physicians. We have applied this non-surgical treatment to treat pattern hair loss in men and women and have achieved improvement in hair coverage for over 99% of patients by thickening thinning hair and stimulating hair growth of dormant hair follicles. We've been able to show that for men and women with thinning hair, that TrichoStem hair regeneration is a highly effective alternative to hair transplant surgery. In fact, we have used this treatment to improve the results of recently performed hair transplant, as well as hair transplants which were performed many years prior. When it comes to genetic pattern hair loss for African hair, we've seen improvement in hair thickness and hair quality, ultimately resulting in better scalp coverage. I make it a point to distinguish what we do with TrichoStem hair regeneration from other injectable hair loss treatments. For example, many practices are offering PRP injection on a monthly basis. PRP alone can stimulate hair growth, but this benefit usually comes after multiple injections, and the results of even one injection can't be sustained past the short term. Many people come to us after trying PRP alone for hair loss and seeing minimal results and getting frustrated with how often they need treatment. Other hair restoration doctors have adapted their own cookie-cutter single formulation A-cell plus PRP. These practices apply the same PRP and extracellular matrix formulation for every patient, and similarly require several treatment sessions over a few months. Practically speaking, the pain and inconvenience of multiple treatments cause many people to abandon these treatment strategies. Our TrichoStem hair regeneration treatment is customized for every patient based on data which I looked at after treating large numbers of patients from all over the world over many years. I developed a classification system which corresponds with different formulations and delivery methods and factor in the individual's age, gender, age of onset of hair loss, degree of hair loss, and other medical factors, as well as previous treatments. Most of our patients have had sustained benefits from a single treatment for 3 to 5 years. We know this because we follow our patients' progress every 3 to 6 months with microscope photos and high-resolution digital photography. Some of our patients benefit from a second treatment we call a booster at around 18 months later from the first. Hair loss is managed, not cured. Some patients also are optimally managed with supplementary pharmaceuticals such as a DHT blocker like finasteride. During my consultation with men or women of African heritage, I do caution that the effectiveness of our TrichoStem hair regeneration is limited by the presence of viable hair follicles. If there is no hair follicle, there will not be any effect. We can't create hair. This means that a long history of using caustic hair relaxers as well as tight braids or dreadlocks can limit the number of hairs which we can treat. Interestingly, we have had a significant number of patients who have been pleasantly surprised with the amount of hair growth they had after our treatment. Patients who had scalp micropigmentation are often relieved that the area they had tattooed doesn't look as fake as it did before our treatment. Every patient is an individual, and I've had patients who wore wigs who had extensive hair loss from chemical burns using hair relaxers. Although I didn't anticipate much growth, the little growth that they saw made them very happy. It didn't change their need to wear a wig, but they were still very excited to see improvement. While there are some differences in hair and hair loss amongst individuals of African descent, hair loss treatment can be performed with the same principles we apply to Asians and Caucasians. It is important to limit potential further damage to the hair due to hairstyling and chemical straighteners. Male and female pattern hair loss is hardwired in the genetics. With TrichoStem hair regeneration, we help our patients increase their hair thickness and density for as long as is genetically permissible. I can say without reservation that TrichoStem hair regeneration is safe and effective for people of African heritage. I hope you found this information helpful. Thank you for your question.